Alrighty, you're live.
Hey guys, it's Dr. Emer. We are now doing Fraxel damage. We've already done this once on my patient, so this is perfect for second treatment. He's actually somewhat still healing from it, and I always tell people the first two treatments you do closer together, and then I usually tell people space it out a little bit longer or do a peel, like do a lightening peel or something like a Cosmelon or a lighten a few weeks later, because then your skin is going to look so good because you've done not only stimulation of the pigment cells and sun damage cells, but then you've also released basically all the pigmentation that's in the skin. Right now, this is going to help shrink pores. This is going to help remove sun damage. This is going to help improve pigmentation, fine wrinkles, etc. And I always tell people, Fraxel is still the gold standard treatment for non-ablative facial rejuvenation. And what that means is if you go and zoom into the skin, take a look super up close, come on all the way in there, you see these little baby dots. You see those dots? One more pass. Those dots are little channels called microthermal zones, MTZs. These MTZs will exfoliate over the next 7 to 14 days. Usually by the third day they're closed, which means this first 72 hours is the most important time for putting products onto the skin because they're going to absorb better. And that first 72 hours is when you're the most irritated and swollen, so antioxidants, growth factors, stem cells, etc. will help you heal much more quickly and make you look a lot better faster. So right now we're just getting him on this maintenance plan of following his sort of treatment plan. And normally what I tell guys to do is do the first 1, 2, or 3 of these kind of closer together, and then you go every 2 to 4 months. I think I do mine every 2 to 3 months with the Fraxel. I do Clear and Brilliant or Fractura, which is a needling treatment for tightening, which I'll be in New York on Saturday and Sunday talking about for tightening of the skin. And basically that's it. And if you look really close, what's great about this treatment is these little dots just exfoliate lightly so you don't look so terrible. How did you look? I saw your pictures and everything. How did you feel you looked the last treatment that you did this, like afterwards?
I was certainly red.
Do you feel like your whole life was ruined? You couldn't go out? Or
oh yeah, for a few days you're just like, oh,
swollen and a little
I'm gonna
crazy.
be inside. So I knew what to expect this time.
Got it. But what about like after a few days? Do you feel like you could still go to the gym and do other things, or no? Were you hiding?
I hid just because I was like, I wanted to wait until I looked.
So you were fully healed,
yeah,
looking and presentable. But some people, I will tell you, they go. I mean, we were doing really strong on you, so I can understand. I mean, but what's great, what I'm trying to explain to the viewers, is non-ablative lasers like this, even with the redness, turn all the way to the left, you don't have to hide if you don't want. It's not going to put you at risk for an infection. You don't have to really restrict things except for sun. I tell people for 72 hours, the gym might be a little bit better to avoid because you're going to kind of flush a little bit from the redness and the inflammation. But listen, I've had patients that just don't listen to me, and I see them at Equinox that night. I'm like, what are you doing? You know?
Mine was more like, I didn't want to go to SoulCycle and see people that I knew see my face. I'm like, I'm gonna wait until they see my face when it's all good.
My best friend from here just had Fraxel Erbium done, and he's been posting pictures on her Instagram and some other things, and he's literally hiding, and I'm like, you look fine. What is the big deal? You look fine. But he gave out some cards yesterday because people said, what did you have done? He just gave out the card. I was like, see, it's advertising. You never know. People want to know, you know, that's the thing. They really want to know now. Is anyone asking you anything or no?
Can you use skincare later on tonight after?
Yeah, I want him to. So this was the point. With non-ablative lasers specifically, these channels are open and they are just calling to get fertilizer. 1, to help heal, and 2, to improve the outcome. So we want him to, and part of our protocol is antioxidants, growth factors, and stem cell products. And then for exfoliation, these little dots will lift. So you want to exfoliate them. You want to use an enzymatic cleanser and a gentle cleanser. We like papaya enzyme or something called Restore C, which has fish enzyme. And then I would tell him, you know, depending on when we want to laser and stuff again, it may be good 2 to 4 weeks from now to do him to do a mask peel, like Cosmetic or Enlighten, and then wait a little bit of time, maybe 2 to 3 months to do a laser. You know, other things, I mean, you could do microneedling, you could do very light stuff, but we might not need to do this stronger resurfacing unless somebody really wanted it. You know, I had some clients that love how their skin looks with it, and they want to do it. They notice it, especially after the second treatment, more. So it just depends. You know, I have a lot of active people that have sun damage last pass that really want to do more of these treatments, but I think when you're younger, you don't necessarily need to. I think alternating lasers with peels and doing proper skincare and micro-rolling at home makes a significant difference in the overall look and brightening and glowing of the skin.
Can you do microneedling immediately after this treatment?
Yeah, we can do this with microneedling and PRP, and I often tell people you should, because 1, the outcomes are better, and 2, there's much less redness. Turn all the way this way. Perfect. Now we're going to go to the other side. You could also combine this with microneedling radio frequency like Fractura, Morpheus treatment, which we just did in the operating room today, or you could do fillers like we've done. I like doing Sculptra with this because I think it boosts collagen a little bit more. Yeah.
How often can you do Fraxel?
Well, that's what we talked about. You really could, if you had scars, you really could do this every 3 to 6 weeks. I think your skin needs some time to heal. This is like running the marathon, you know. So the first treatment or 2, maybe you do a couple closer together, 2 or 3. I mean, a lot of people do those a month to 6 weeks apart. For the long term, I would say at least every 3 to 4 months to really keep for rejuvenation. And I think if you have scars, you can spot treat a little more aggressively more often. The other thing I want to point out, right over here by the ear, everybody gets these little wrinkles there as they get older. So preventing him from getting those wrinkles, we're going to Fraxel over that area. And sometimes it's even good to Fraxel the ear itself, which I did a couple times the other day, not online, but for patients who have sun damage. We want to shrink those pores, so we want to go on the nose.
How is Fraxel different from erbium?
Well, erbium is an ablative laser, so that's going to make you scab. Check out my Instagram story today, and you'll see what one of my patients has to say. He did both, and he did one erbium around the eye to get a little bit more improvement. There's no specific number of erbiums that equates to a Fraxel, but some people will say that 3 non-ablative lasers equate to 1 ablative laser. That's strong. So if you do the CO2 or an erbium once, it might be equivalent to 3 or 4 Fraxel treatments. Now, some people don't want to do a very strong laser all the time, so they'll do it once or twice a year. When they do their Fraxel on the whole face, they'll treat their eyes with the erbium. So that's Fraxel, guys. I think we answered all the questions. The aftercare is important. If you have a history of cold sores, you might want to take some Valtrex. It's not necessary, but it can sometimes prevent those from popping up. And other than that, skincare is essential afterwards. He's going to look red for the next week or so, but he's going to look great. That's the goal. Thanks, guys.